Hey there, welcome back to How to Medicate and welcome to this new video on how to use Gabapentin, also known as Neurontin. This video is part on a video series on mental health problems, and for those of you interested, check out the playlist in the description after watching this video, of course. For those of you meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewers. Because I believe that medically educated people make healthier decisions, which is the whole point of this channel and this video. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice. And when looking for medical advice, always contact your own doctor. And now quickly, let's get learning. So as mentioned, the generic name of this medication is Gabapentin and it's sold under the brand names Neurontin and Horizant. And it's available as a tablet and a capsule. Which brings us to how to use this medication. If you want to use it as a tablet or a capsule, make sure to swallow it whole with half a glass of water. Do not break it and do not chew on it, as this can decrease the effectivity of Gabapentin. Furthermore, it's advised to take it at fixed times. This will make you less likely to forget a dose. In addition, after a few days to months, your doctor will evaluate if Gabapentin is sufficiently effective for you. If necessary, your doctor will adapt your dose or will switch to another drug. Now, Gabapentin is part of a group of drugs called anti-epileptic drugs, and it can be used to treat epilepsy as well as neuropathic pain. Which brings us to the correct dosages to use. And here I want to mention that the dose can differ a lot depending on your specific indication of use, the severity of your symptoms, and your blood levels of Gabapentin throughout your treatment. Therefore, always use the prescribed amount and frequency your doctor gave you. However, most commonly, when treating adults, your doctor will slowly increase your dose up to a maintenance dose of 900 to 3600 milligrams per day, divided over 3 dosages. Gabapentin can be an effective drug, but unfortunately it can have some serious side effects as well. I will mention some of the most common ones in this video, but if you're looking for a complete list, check your leaflet, ask your doctor or your pharmacist. Very commonly it might cause somnolence, dizziness, fatigue, or an increased risk of a viral infection. Commonly it can cause pneumonia, infections, aggression, fatigue, confusion, anxiety, tremors, convulsion, and erectile dysfunction. Uncommonly it can cause allergic reactions, high blood sugar, swallowing disorders, and edema. And rarely it might cause palpitations, a low blood sugar, or respiratory depression. Which brings us to the safety of use. First of all, be careful to combine Gabapentin with alcohol, as this might increase the side effects you're experiencing from Gabapentin. Furthermore, also be careful when driving, as Gabapentin can cause fatigue and confusion, which will make it dangerous for you to drive, so take care. Furthermore, Gabapentin can also have some interactions with other drugs you're taking, therefore always discuss this with your prescribing doctor. And lastly, we're taking a look at the safety when pregnant and while breastfeeding, and unfortunately there is insufficient data to conclude if Gabapentin is dangerous. However, it seems to be dangerous in animal studies. So always discuss the pros and the cons with your doctor to see if Gabapentin is effective for you. Now, I hope you know now how to use Gabapentin, but if you have any questions, let me know in the comment section and I will do my best to answer each and every one of them. For those of you that want to keep on learning, check out the mentioned playlist in the description, because educated people make healthier decisions. Don't forget that. Thank you all for watching, and especially thanks to my Patreon supporters. Thanks to Sebastian, who's an InvestorT supporter. And for those of you that did learn something, please leave a like. This will help out the video tremendously, and consider subscribing. I'm trying to reach 100,000 subscribers before the end of the year, and you can help me reach that goal. And in return, you will never miss such an awesome medical video ever again. Lastly, for those of you that can't get enough, check out my Instagram account @HowToMedicate. And I hope you enjoyed my new neon sign for the new studio. Thanks again, and as always, I will see you next week with a new video. Bye bye.